Sure. So the question was, we're talking about the pandemic maybe peaking later on, and we're talking about doing a detasseling task force. So a couple things. One, we're going to be doing social distancing for a while, folks. I mean, until there is a way that we have a vaccination or something like that, we are not concerned about the spread of the virus, we're going to be doing social distancing. Now, that's why we want to start taking steps now to kind of start planning what would that be like for our detasselers, as an example. Dr. Kahn will tell you that the models that are out there are not predictive. And in fact, he said that on NET when we had our show a 3 weeks ago. So, and just specifically with regard to the IHME model, that model has moved around all over the place. So again, it's not a predictor. But what is real, what is actual, is what's going on in our healthcare system. So we've actually got as I mentioned yesterday, or a couple days ago, we have a dashboard out there that shows what percentage of our hospital beds are available, what percentage of our ICU beds available, what percentage of our ventilators are available. You know, for example, let's just take Omaha. 38% of the hospital beds are available, 44% of the ICU beds are available, and 75% of the ventilators are available. So that's our major metropolitan area, and we have lots of capacity there right now. In fact, of those ventilators, we actually had 106 people on ventilators yesterday, and now only 89, and 16 of them are COVID. So you can see coronavirus is really, I mean, that's why we're focused on what we can see and what is real, not on what somebody's model is that, as Dr. Kahn said, is not even predictive.
But the numbers are rising, you know. This week you've seen it rise pretty dramatically, and you said the peak would be in late April or mid-May. Are you still sticking with that?
So, yeah, so again, the models show, and this is why we say the models are showing that it was going to be late April or early May or something like that. But again, okay, so let's go back and look at the data, because I think Henry Cordes did his own article that showed that really a lot of the rise in our cases are really focused in some areas like Hall County or Dawson County, Dakota County, Madison County. So again, they're in places where we have big concentrations of people who are concentrated close together for whatever reason, whether it's living conditions or workplace or whatever. So again, we have to manage those, absolutely, and we deploy resources to manage that. So, but again, and in all those areas, we've managed it so that we have not overwhelmed the healthcare system. And Hall County is a great example of how CHI has worked really hard. They've transferred patients out, they've brought staff in, so we're managing the healthcare system.
So the answer is you don't know?
Well, the answer with regard to the peak is it really doesn't matter so much as what happens with regard to our hospital system. At the end of the day, what we know and what we care about is making sure that every Nebraskan, if they need a hospital bed, got one available. If they need an ICU bed, they got it available. If they need a ventilator, it's available.